communities of practice is first, and then talking a little bit about the benefits of that and the networking opportunities that we know already exist and ways that you as professionals can access networking and communities of practice. So firstly, we wanted to go into a little bit more detail on what is a community of practice. It's a term that many of you are very likely aware of and used to, but it may be a new kind of idea that people haven't looked into yet and haven't thought too much about. So we wanted to start by really explaining what that is. So a community of practice, it is a group of people who come together in any way, who share a common concern, set of problems or interests in a specific topic. It can be professionals coming together from within the same job role, so a group of health play professionals, play specialists, play workers, or it can be a group of professionals from different job roles. So you could have some play professionals, you could have some members of the multidisciplinary team. As long as you all have that same interest in a topic or share the same concern, it would be a community of practice. These can be held face to face, in person, or also virtually, which we have obviously all become very used to doing now in the past few years, and it's to making it a lot more accessible for people to have that option of meeting virtually as well. So what can a community of practice be? So communities of practice are they can be a formal group setting, meeting as a group, as we said, whether that's face-to-face or virtual. It can be very informal, as an irregular meeting and a regular meetup with people when you can come together just as and when it's needed. If there's a particularly stressful time that you're facing, it may be worth coming together a little bit more often. If there's a specific area of work that you're celebrating or that you're working on, it may be needed to come together with other like-minded professionals to talk in more detail about the work that you're doing. It can be either informal or formal. It is a form of peer support to share your ideas. And it can also be led by somebody else. So you could have somebody join the community of practice to support the minute taking and to support the facilitation of the meeting. It very much can be what works for you and a way that you really see the benefit from yourself. Communities of practice is something that is encouraged by the NHS. We've included a document on here, their learning handbook, which supports how you may look to run a community of practice within your settings. We'll pop the link to this document in the chat so that you can have a look in a bit more detail after the webinar if you would like to, but it kind of explains when they should be held, who should be involved, and all those kinds of things. Next, we just wanted to look at some of the real benefits of networking, the benefits of coming together in any way that you see fit. This breaks down into quite a few different areas. There are so many benefits of coming together within a community of practice and having that access to networking. So we just wanted to pull some of the real key benefits that we have found for you. So the first one is the knowledge sharing. It supports sharing of best practice, helps to keep up to date with current guidelines and advancements in the work that you're doing. It provides the professional growth. And one of the real key kind of standout points to that for me personally is the mentorship that you can gain from networking and supporting each other through your role, offering guidance on growth and career pathways, as well as educational opportunities that arise for your role. The emotional support that brings. It offers a safe space to share experiences with like-minded people who have been through the same thing as you, who may be facing the same kind of upcoming challenges, or also people that have witnessed kind of and experienced the same things, that have managed to find a really great way to help themselves to work through that. It's a great opportunity to share what people have learned through their own experiences. It also supports collaboration, which we all know, especially working in the kind of fields that we all do, it's absolutely vital to have that opportunity to collaborate with other teams, work between, whether that's departments, different settings, to kind of learn from each other, working within the same setting but different teams. That all kind of leads to that improvement of patient care and patient experience. It supports problem solving. Having that kind of diverse perspective and sharing of experiences can lead to that kind of solutions for any challenges that you may face. And it strengthens resilience, which is one of the points that we really want to be focusing on today as well. It supports you, reduces isolation, keeps that motivation high, and just gives you that job satisfaction that I know we all find that we feel a lot, but sometimes it can be a little bit more difficult to kind of really pick that out. All of these things lead to the improved patient care. So by fostering that collaboration and that networking opportunity, it ultimately contributes to delivering a higher quality of patient care and that higher patient experience that we all work so hard to achieve. Thank you. So one of the things at Starlight that we have done is brought together a group of professionals who champion play in healthcare. They are called our Starlight Health Play Champions. We currently have 115 of them, which is absolutely incredible, and something that I personally just love being a part of. It's such an incredible group of professionals. It's a real mixed group. So we have a lot of play specialists, play workers, we have some nurses, we have nursery nurses, and sibling support workers, lots and lots of professionals that come together from different areas of the healthcare settings and the healthcare system to support each other, get that peer support, and really build those connections between Starlight and healthcare settings. Some of the things that you can sign up for with being a health play champion, which I think Laura's just popped the link in the chat if anybody is interested to sign up. It comes with the trialing products for Starlight. So when we're looking at building new resources, our health play champions are an absolute integral part for us to do that, gaining the feedback and the evidence that we need to really make sure that we're focusing in the right area. The health play champions get access to any early training opportunities which are provided, where they're obviously really improving their skill and their knowledge and their confidence in certain areas, but that also brings that aspect of networking and communities of practice where it's given them that opportunity to be in a room with like-minded people with interest in the same topic and really learning from each other. We then have our monthly networking group, which we do virtually on Teams. It's an hour and a half a month. And it's just an incredible opportunity to kind of, for us at Starlight, to hand over to the champions and say, what do you want to talk about? What do you need support from your peers within? And it's a really great, open, safe space to talk about maybe any challenges that people have been facing. If there's an area of work where people have particularly found has worked really well, or some new ideas that they've trialed that have gone really well and successful, to share those ideas and to help that peer support and that peer learning. We also hold some focus groups as well, which brings that aspect into it, but focusing on a much more kind of specific area of work and how we can develop on that and introduce that into healthcare settings too. So I asked our health play champions before this webinar, what would you say about networking? What are your feelings on it? What are your views? And what do you think? What benefits does it bring you? And this word cloud here is some of the answers that they sent our way very kindly. Some of the ones that really stood out for me was the understanding each other. And I think sometimes when you're working within healthcare, whatever role that may be, it's really difficult to have that understanding of other job roles and other people's work and kind of the experiences that other people face. And I think bringing that understanding together into one place is really beneficial. Really kind of great experience for them. They said that it's relevant. It keeps them up to date with what's happening within Starlight, but also within other healthcare settings and within the field. Networking with people that are the same as them and having the same experiences and the same kind of feelings as them and reflections as them, and having that open space to ask questions to people that understand them and understand kind of where they're coming from with those questions as well. So we're very grateful for any of the champions that sent that feedback our way. Thank you for supporting this. I'm going to hand over to Laura now, who is a play specialist at West Hospital, who's going to talk to us a little bit about her experiences of networking, some of the barriers that she may face in that, and over to you, Laura.
Hello, thank you. So we all have really different experiences of networking, and we all know that play specialists are quite stretched thin, and we all need time to do the networking as well as our day-to-day job. So most of my experiences of networking are study days, whether they be within my trust or at other trusts that are locally. Um, East of England days, social media. Um, so also, when we've been to like the Just Play study days, it's linking up and making them connections that you can then bring into your service. Um, Supervision, general team meetings. Um, so we all have different experiences and different views of what our networking would look like. Unfortunately, networking does come with barriers. So, many of us know that there is not enough health play specialists at the moment in hospitals in general. And there's no cover when you are away. So, for my example, we are quite a small team here at West Suffolk. So, there's myself and another play specialist in ED. And there's no cover for us when we need to go to study days, which means the ward goes without and the kids go without, which is quite sometimes a hard decision to make. And that links in with the lack of time, um, having the time and the ability to split yourself between roles and jobs and meetings, and making sure you cover the ward to try and get somewhere, or make sure you've done the jobs before you go. Um, there's a lack of understanding about our role as play specialists. Why do we need supervision? We just play. We never just play. We're always doing it for a reason, and making them connections with the families that we work with and the children and the young people that we work with. Um, and also, why do we require study days? Why do we require networking? Um, you know, how much do you need to network? Well, actually, things are changing. Things are getting more technical, with the VR headsets, being able to see the impact that the play is having on different environments and different treatments and procedures. The lack of knowledge, so the lack of knowing what networking is out there, what meetings are out there. When I came into my role, there was no one for me to follow on from. They'd been on long-term sick, so there was no sort of handover. So it's finding your feet and finding the different people that you need to speak to get where you need to be for these meetings. So I actually didn't know much about any charities, including Starlight, until I had to start looking myself and start researching. And if you don't know the opportunities are out there, you can't do them. Shift patterns, we all work different shift patterns. Some of us are Monday to Fridays, some of us are weekends, some of us are evenings. And it's working around them shift patterns to fit in that ability to be able to communicate and network with people. There's often also, as we know in play, there's no funding budget very rarely, even for play equipment, but there's definitely not anything really for training and things. So it's usually you're self-funded, or it's part of your mandatory kind of training. So I've already discussed that smaller teams, we have no cover or lack of cover. Me and my colleague, we work different shifts, so we can't stretch ourselves any thinner. Confidence. If you're a small team and lacking that confidence to speak out or to ask for help or to put yourself out there into meetings, it's very tempting sometimes when you're told you're on training to just sit quietly in the corner and not contribute. But when you start to contribute, you can start bringing in, your experiences, as well as finding out what others' experiences are, what worked for them, and could you implement that in your workplace. Also, sometimes it's out of hours. So for myself, I believe that some of the meetings are on weekends. I'm working Monday to Friday to then do another day on a weekend. I don't get paid for it. It's a challenge. And if we're not if we're in smaller teams and we're not got the availability to network quite so much, we are less likely to hear about opportunities. So that's also a bit of a challenge. Benefits to our work, it's endless. There's the benefits of reflective practice, bringing in new skills, knowledge, making them new contacts. We all have different puzzle pieces, I like to say. So a puzzle piece that a physio holds is different to the puzzle piece that we hold, and actually by working together we can put the whole puzzle together so that child's getting that continuity of care. So it's benefiting our patients, their families, their siblings. They're all getting that continuity. Some of the challenges are that we all work off different systems. So the notes I have for one child, if they are then sent to London to a bigger hospital, the notes or the play plans or whatever I have written may not go across with them. So then it's almost like the play specialists have to start again in their area. So it's making them contacts and knowing who to speak to. Networking can be like you're informal, you're formal. We have supervision. That's the type of networking that I liaise with the psychology team. We discuss different cases. We share what we're doing. We take students that sometimes work with us and learning their experiences as a child when they're, at the moment we're taking T levels, which are the younger age bracket at college, and they're able to bring their experiences to it. So it's good to get the feedback from them as well, and overall just make an overall care that is, we talk about MDT, but we also need to all have sing off the same hymn sheet. And if not everybody understands our role, because we haven't been networking or putting ourselves out there, it's difficult to then all sort of share the same understanding as such. Hopefully I've covered it, Natalie.
Absolutely perfect. Thank you so much, Laura. It's so interesting to hear from your perspective, to hear from, especially being in that kind of smaller team, and barriers that you face with networking, but the ways that you've gone about trying to get around that with like networking with the other areas of the MDT, and kind of the different ways that you can gain support for yourself as well to kind of keep yourself going and really look after your own well-being as well. So it absolutely brilliant. Thank you so much. We really, really are grateful for your time and for sharing that with us.
It also, I know guys, we always struggle with like our revalidation and things. Use that networking to reflect on things and put it into your reflective practice and use it that way around, as well as your patient focus.
Absolutely. Thank you, Laura.
Thank you.
Lovely. So what we really wanted to focus on from having that conversation with Laura and really hearing from Laura and the smaller team and some of the barriers and the difficulties that everybody can face to accessing networking. I think regardless of team size or setting that you work in, it can be really difficult. It can be really difficult to have the time, have the space to access those kind of more formal meetings, and to, in the role that we do, it's a caring role, it's a caring profession, and to be able to kind of put your needs up there right at the top with, I am really important and looking after myself and my own well-being is important, and it should be key. It should be right up there as well for ourselves, but also for the care that we can then give our patients. So we really wanted to kind of follow on from Laura's experience and Laura's incredible example there as to other ways that you can look at communities of practice and networking and ways that are maybe slightly different. So this is called appreciative inquiry. It may be something that many of you have heard of before and do partake in and do kind of put as part of your daily role and your weekly practice. But we wanted to just give a little bit of an explanation just in case anybody hadn't heard of it or it wasn't your kind of natural working style. So appreciative inquiry, it's a coaching style to support each other. It's a way for colleagues to support each other and to gain that kind of support back and really put your own well-being up there at the forefront of everything that you do. So some of these principles of appreciative inquiry really stood out for me more than others. It's the words create worlds. I love that. I love that kind of overall umbrella as to how to explain that. So as we know it, it's a subjective and objective state. It's socially created through language and conversation. It's just that power of conversation and opening up that space to speak to somebody that you trust and somebody that you get on well with, to just have that support and to support them back. It's the moments that we ask questions that we begin to create a change, to just be curious and to ask those questions about other people and to allow other people to ask those questions about you. The positive questions lead to positive change is just key. I think it's the one out of all of them that stood out the most for me. We can avoid spiraling together through reframing. And we wanted to give you some prompts here on if you were to participate in appreciative inquiry, what that would look like and how you would go about doing that. So it's a sense of, as we say, finding somebody that you trust in a safe space that is completely non-judgmental and really listening deeply and fully. And this is something that we do talk about within Starlight as well, of that listening to listen and not with the urge to kind of think about your response or think about a solution to what the other person is saying, and just really let the other person know that you are completely hearing what they say, to go into it with a non-judgmental kind of persona and non-judgmental space, and to ask open questions to keep the problem solving within the owner's space. So asking questions such as, how did that feel? What else was going on? Who else was there? What can I do to help? Once you finish listening, once that person has really had that space to completely speak about what they need to, what have you done so far? Why is this important? Why is it important that we're talking about this now? And how are we going to move this forward? And what would the impact be of us not doing that? And it's just, as I say, having that space to really allow the person with the problem to speak openly and in a way that works for them, and listening in a really non-judgmental, open space to allow them to say everything that they need to say. And it brings so many benefits of just feeling that load coming off from just allowing a person a space to tell you their problems and tell you what they're focusing on and what they're facing at the moment. But it also allows the person sharing the problem to really think it through and to think about ways that they can help themselves in moving that forward. And you'll find a lot of the time in appreciative inquiry, the person doesn't need a response or the person doesn't need a solution from you, because having that space to talk openly about what their experiences are and how they're feeling, it allows them to process it themselves and to have that reflection while they're talking, and to come to an answer and a solution for themselves, even if that's, do you know what, I need some more support from this person, or do you know, I really needed to just talk this through and process it. I don't actually need to do anything with it from here. Or this has actually really helped me and I would really like to do this as a regular thing, and give each other the support and the time to speak openly. So there's so many different benefits that can come from appreciative inquiry. But those are some of the really key bits that we wanted to raise with you. So our last few slides are just focusing on some of the existing networking opportunities that we have been able to find from some support from our champions and from the Society of Health Play Specialists and the amazing Facebook group that there is for play specialists, the font of all knowledge. We have obviously spoken about appreciative inquiry and what you can do within your settings if you don't have access to networking. But it's also really, really important, I think, to know what networking opportunities there are. And as Laura mentioned in her slides before, sometimes that's one of the biggest hurdles, is not knowing, is there a networking group in your area? What can you access? How do you access that? Who would you go to? So we just wanted to include here some opportunities that we know that there are for networking. So there's, as we've already mentioned, the Starlight Health Play Champions group. We meet monthly for a networking call on Teams. It's an hour and a half. It's very, very informal. If you need to kind of join the group and then go off because you've been called from patient and come back, that's absolutely fine. As long as you're benefiting from it and the champions are benefiting from that networking group, we're absolutely happy for it to kind of be run in a way that works for you. And we change the day and the time of that each month to try and suit people that work part-time, and try and fit as many needs as possible. There are then many, and more than I actually realised before researching into this, regional play networking groups. We've listed as many as we could find on here. There is every possibility that there may be more that we don't know about. So if there are, we would really encourage you to come forward and let us know if there's anything that's missing from here so that we can share that with others. We've also put a link at the bottom of this slide, but Laura is also sharing all of the links on the chat. Because I know the Society of Health Play Specialists did a little bit of work recently where they asked for everybody to pull that information together about networking groups so that it could all be logged in one place. And the link that is just on the bottom of the slide here, which we'll also share in the group as Laura has just done right now, in the chat, that gives that little bit more detail. So if you can see a networking group on here that is in your area or that you think would be great for you to join, if you go to the SOPS link, it will tell you on there when they meet, how regularly they meet, and who the lead contact is that you can reach out to via email to hopefully join yourself up to a networking group. And we are very, very, very keen for new play champions. We want to really bring together more people to offer that peer support. We're also really focusing in on trying to bring other areas of the MDT and other professionals into the Health Play Champion group too. So please don't be put off if you work in a role that isn't a play professional. We're very, very keen to have as many healthcare professionals join the Champions group as possible, anybody that works to promote and support play. You. And then we have a list of some of the upcoming networking opportunities that the Society of Health Play Specialists have kindly shared with us. So they have a diary of events coming up, which we've listed here, which will also provide that kind of training and that skill based focus, but also comes with that networking opportunities as well for play teams and play specialists and play professionals to come together, support each other, network, and also improve in skills and confidence in all sorts of different areas. These are also listed on the Society of Health Play Specialists website as well, and as Laura said, we'll be sharing the recording on our website of this webinar at the end, so don't worry too much if you don't have a pen and paper to write those down right now. For anybody on the call that doesn't know, SOPS is the Society of Health Play Specialists, so they are they oversee everything play related, the training and the work that happens in the settings and the incredible work that happens by play teams. We've shared their website link in the chat, and we just wanted to focus on something that SOPs have held very recently. I think it was the week before Play and Healthcare Week. They held a wellbeing day, and it was a study day in Leeds which focused on the wellbeing of staff and how important your wellbeing is. And we felt like that was a really, really great place to kind of bring the webinar to that we've held today for you, with really focusing on that communities of practice for success and how having that community of practice, being part of a networking group, doing any kind of networking that you can in whatever form that may take, it is absolutely key for your well-being, and just to know that you've got that support there. A lot of people work in small teams or lone workers, and it's really, really, really key. And Tina Clegg, the chair of the Society of Health Play Specialists, shared with us that the learning for her from the Leeds study day, was to make one small change for you. And I think that is something that we are all very much on board with. So we wanted to leave you with one last thought. And that is, if you were going to take something away from today and from what we've spoke about, we really want you to think about these 4 questions. So who do you have within your setting to network with? It could be within the same team that you work in, or in another team, somebody that you work quite closely with or have that really good working relationship with. Who can you practice coaching with? Do you have a colleague that you feel safe to open up with. You have that trust in work relationship that you could practice the coaching, the appreciative inquiry. Can you reach out to somebody to gain support from them? And will you join one of the regional networking groups that we have listed? Thank you so much for listening and for being here with us. We're so grateful for your time. And I'll hand back over to Laura.
Oh, amazing. Thank you so much, Natalie. I'm actually just going to stop presenting so that we can see each other as much as possible. There are some comments in the chat which I will come to, but I wanted to just firstly just say a big thank you to you, Laura, sharing as clearly as you did about your practice, some of the challenges, time, overworking to take that time off, cover, budget, the sense that the time is not part of your work. I heard those really clearly. The lack of awareness of why you in your profession would need to network and to connect with others, the difficulties of shift patterns and going into your overtime to do this work, which when you're already caring in your role and stretched to your capacity, that is a big ask and kind of an unfair ask. But you really talked so clearly about the opportunities that came with networking and connecting. The different pieces of the puzzle was a beautiful way to explain it, that we all add a little bit of the picture, and when we come together we can see more clearly. And you gave such brilliant examples of professional sharing, so thank you so much for your time today. It was so stimulating, and I think there's a career for you in TV. Just saying, planting the seed. Now, also, what we've heard a lot today through what Natalie and Laura have talked about is the importance of connecting and relationships, or mixture of those two words, and the opportunity for kindness within that, the opportunity in being seen by somebody. It is really important not to underplay that in your profession, the importance of being able to say you need something as well, and sometimes through some mutual giving, which I think is what you really described so well, Nat, that is possible to have that in, as a two-way street. So just looking, Amanda, you have talked here about being a registered health play specialist and providing that pre and post bereavement support to children and families. Would you be willing just to say a little bit more about that?
Yeah, absolutely. So I really am finding that I'm kind of dipping back into the health play work, as much as I'm not here as a play specialist. But a lot of the time children are talking about their own health anxieties when they're seeing their loved ones. They're seeing the decline in their health, so they're very much kind of coming up with questions about how their health and their safety. And then a lot of questions around treatments that they're seeing their loved one receive. So really noticing that I'm kind of floating back into that kind of work, which I'm really excited about, but feeling a wee bit like, oh, I'm kind of out of that world now. So it would make sense for me to try to engage and connect again, a place to share ideas and maybe, sort of swap what I'm doing, let you guys know some of the kind of activities that I would use as well with young people. So
yeah, and if there's anything we can do to help with that, to bring practitioners who would like to engage in that together, we'd love to. As from our perspective, that's what we're here for. I just wanted to flag that there is are you aware of the consultation that's happening at the moment across Scotland about palliative care, children's palliative care, children and adult palliative care? You know about that?
yeah,
Brilliant.
yeah, we're doing a lot of work with schools as well around like the charter and stuff. So we're there's a lot of kind of trying to connect with other professionals and just sort of shout about our role. But also there's a part of me that really wants to see if there's any value in bringing, so having my name badge saying, child and families practitioner, but also having play specialist on there as well, and knowing if that's because I'm not directly working with children with their own healthcare needs, and it's more how they're feeling around their adult. But yeah, it's a lot of questions kind of coming up to see.
Yeah.
If that would
Well,
be.
I think from Nikki, that's such a great shout. So as a community practice group, so a group of community health play specialists that come together, that's absolutely right. Might be a really great opportunity for you to join in there. So the contact details for that are, can be available in the chat. Nikki, if you could share how Amanda could join in there, that would be brilliant.
Perfect. Thank you.
Amanda, I'm going to just flag that Adrian has asked if you could say a little bit more about the charter, or even just put a link into the chat.
Yeah, I'll find a wee link and pop it in there. It's
Amazing.
just around schools being able to have that sort of charter mark to say that they're a bereavement aware school. But I'll pop some more information in there.
Thank you so much. So we've also got something here from Sarah from Manchester, and her reflections on adopting a coaching style are there in the chat. And it sounds like that the underpinning feeling there that you've got, Sarah, is about really looking after each other, supporting and looking after each other. It'd be great to hear if that's something that you're already doing in your team. So do raise your hand if you feel like you'd like to talk about that. I've got a question for you, Natalie. So you've talked about some of the characteristics of the Champions Network, and I wondered if you could say more about which professions would you like the most to be joining the Health Play Champions, and maybe a little bit about what Starlight get out of facilitating the Champions Network.
Absolutely. The Champions is one of my favourite things to talk about, so that is absolutely fine. So I wouldn't say that there was really a limit on what kind of role we would be looking to join, as long as, so what we're looking for is people that work within healthcare to champion play, support play, and advocate for play. So if there are professionals that already do that, like incredible role of champion in play, that want to join, if there's any colleagues that play specialists have that their kind of areas of MDT really understand their role, really bring that playful approach to their work with children, we would love to have them as part of the Champions group. There's lots of reasons for that. We would love to hear from all kinds of perspectives of the healthcare settings about play for children. We also think it's a great way to continue advocating for play and the importance of having play specialists and play professionals within the settings. And also, I think it's really helpful and really beneficial for play teams to see that there are actually a lot of professionals that do really appreciate the role, really appreciate the work that happens, are so passionate and keen and proactive in championing the role of play, but also the benefits of that to children and families. So we think by bringing kind of all of those other MDT professionals into the Champions group, it's just going to be incredible. So Laura's shared the link in the chat to the Health Play Champions group, the sign up link. So if there's anybody that you have in mind that you think would be a great champion, or for you yourselves, if you think that it would be something that you would like to do, then please do sign up, or I'll put my email address in the chat as well. If anybody would like to email me, then please do. And then the other question as to the benefit to Starlight from the Health Play Champions, was that the question, Laura?
Yeah, what does Starlight get out of it?
What does Starlight get? Starlight gets to, well, I mean, I facilitate the Champions group and I absolutely love it. So it brings me a lot of joy. We are incredibly grateful for the Health Play Champions. They provide us regular feedback on services that we provide, the need of some of the struggles that they're facing, and it enables us to kind of have a look at what we're doing and what resources we have and where we can face that, and make sure we're kind of directing that to the right places. They provide us with kind of case studies and families that we can speak to really show the impact from that level of the child and their families of the play that they have received. Evidence, like always. Visits to the healthcare settings. They allow us to go out and see the work that they're doing, and sometimes we'll take some of our partners with us to show the impact of their support on Starlight, of what that is having to the settings and the children and the play professionals that work there. They're just absolutely incredible, and we are so fortunate to have this group of amazing professionals that are so open and so willing to support us, and to help us with our aims and our missions.
Well, thank you so much. That's absolutely brilliant. I think from a service delivery perspective, it's really important to sort of note that Starlight is in service to the profession, just to repeat that. And everything that we make available, we do as much research as we possibly can. But part of that is about making sure it's specific and relevant to health play. And it's by, there are so many examples I can think of where health play champions have just been so generous with their time and their feedback on different initiatives, even where we are approached often by people who have a business and want to make it more applicable and appropriate to families when they're in those situations. Nat's really brilliant at being able to sort of set up opportunities to get the right groups of people together so that they, they're able to access those resources and try that out with families, so that we make sure that that's really right. So, Laura.
Yeah, just from being one of the play champions, it's nice to see that sometimes when you do get to speak and put your ideas and thoughts across, that actually you then start seeing it change. So, like Starlight have started putting on the page for professionals where they can access materials, and it's really nice to see it sort of, it's not just, you don't feel like you're just talking to a brick wall. They are actually listening and they're actually implementing changes. So it's nice that actually you see the change happen.
That's so lovely to hear from you, Laura. Are there any specific examples that stick out in your mind of things that you've seen, that you've talked about and then seen happen?
I remember the conversations around how we can have more resources and the time it takes for us to make resources. And even if the time it takes for us to sit and do a social story, or and we don't all have the access to the programs that create them. And then on Starlight appears the professional page, and now there's the really handy procedures and treatments social stories, which I have then used. I may have adapted one to make a snap game, but that was but it's there, the basis is there, and then you can tweak it to fit your setting. But you've started doing the hard work for us, so it's almost like we don't need to sit and if you haven't got time to make a certificate, you can go on there and just print one off and fill it in, and it does save time, especially when you are under so much pressure as all the teams are.
That's so brilliant to hear. And Nat and the team, such amazing work to push that through and make sure that those things happen. And I cannot tell you how much joy it brings us when, for example, we see the Play in Healthcare Week pictures of play teams in their settings, and we can see those resources up. It's just so incredibly satisfying.
Can I just add to that it's the perfect example, so thank you for sharing, Laura, on how the champions support Starlight. So when we kind of started to develop the idea of the hub, the first thing that we did was went out to the champions and said, what do you want to see? What do you need? They gave us the ideas of what would be helpful and what they wanted to see and what should the priority should be. But they also sent, for an example, audit sheets. If a few hospitals were already using them. They sent us examples that we could pull some best practice from to make something that would be kind of universally usable to lots of different people. So it's just the most amazing example. Thank you, Laura, for the ways that the champions help us to move our services forward and make sure that we're kind of focusing on the areas of need. So yeah, thank you.
It's like a full circle. Champions helping us so we can help the rest of the profession so that children and their families can have better experiences. Thank you.
Absolutely.
Hearing from Sarah, who doesn't have camera or mic, but wants to say, as we are all doing, thinking, agreeing, yes, definitely, we're eager for doing ongoing team development opportunities, workshops for togetherness, connection, relationships, recognition, support, understanding professional standards, quality, meaningful play experiences, focusing on patients' journey and person-centered care. Powerful words. Thank you. And absolutely. So Emma in the chat, Emma Barry says, these resources are what I needed 15 years ago. We are working on a DeLorean so we can go back in time, but I guess when we get it up and running, we won't know because we'll be in the past and the future will be different. I have had such a brilliant lunchtime. I think we'll take this opportunity to draw this to a close and just recognise the amazing energy that there is within this profession. I want to again say a big thank you to Laura for being a guest on this webinar. You've been amazing and so gracious in your generosity. I want to thank Nat, such brilliant presentation, so clear, and such a pivotal role that you're doing to make sure that all of this comes together. To our colleagues at Starlight who are often behind the scenes, who make sure that this work can happen, also a big thank you from us. And please, if you feel that you have colleagues who you work with in your settings or in your networks that are nurses, anaesthetists, speech and language therapists, whatever the role is, admin assistants, who are very tuned in to the benefits of play and you think actually they could be good play champions, send them the link, talk about the work, because we want all of children's paediatric care to be infused with that playful approach so that children remember that they are high status, not low status, so that they can better manage their own feelings, thoughts, and anxieties that come up. So a big thank you from us for everything you're doing. And thank you for all of the support to help us to help you guys. And we're going to say goodbye. Enjoy the rest of your day and have a restful weekend when it comes. All the best.
Take
care.
Take care.
Thank you.
Nice to be polite.
Thank you, everyone.